Good morning. Myself Madhu Rajput. I am from Faculty of Nursing. My designation is Nursing Lecturer. Today I am going to present my topic Myocardial Infarction. First, I discuss the definition of myocardial infarction. Definition: it is permanent damage of myocardial tissue, reduce the blood supply of coronary artery. It means ischemia. After that, myocardial infarction is also known as heart attack. Then I discuss the causes of myocardial infarction. The first cause is coronary artery spasm, then coronary atherosclerosis, and coronary artery thrombolysis, then coronary artery embolism. After that, atherosclerosis, then high blood pressure, then obesity and stress and high intake of smoking and alcohol. Then after that I discuss the pathophysiology of myocardial infarction. In pathophysiology, first start the etiology. In etiology, pathophysiology, coronary artery embolism and thrombosis spasm. Then it is caused ischemia, then caused myocardial tissue damage, then myocardial infarction. After that I discuss the clinical manifestations of myocardial infarction. In clinical manifestation of myocardial infarction, the first is severe chest pain and high heart rate and respiratory rate and fever, nausea, vomiting and high blood pressure and diabetes mellitus. After that I discuss the diagnostic evaluation of myocardial infarction. Diagnostic evaluation of myocardial infarction, the first is, we are collect the history collection. After that we assess the physical examination and MRI, X-ray and CT scan, CVC. After that I discuss the medical management of myocardial infarction. It means what we are giving the drugs give the myocardial infarction drugs. First we are give the morphine and aspirin and sedative and anticoagulant, thrombolytic drugs and after that I discuss the surgical management of myocardial infarction. In surgical management of myocardial infarction, the first is PTCA. PTCA, it means percutaneous transluminal coronary angiography. And we are give the CABG. It means coronary artery bypass graphy. Another one is coronary shunt. Then atherectomy. So these are the surgical management of myocardial infarction. After that I discuss the nursing management of myocardial infarction. What we are give the nursing management of myocardial infarction? First, assess the vital signs of the patient. If suffering from myocardial infarction, then provide comfortable position if patient having severe pain in the chest, and nurse give the comfortable position to the patient, and give routine medication of the patient, then assess the severity of the patient and give the oxygen therapy. Then after that I discuss the dietary management of myocardial infarction. In dietary management of myocardial infarction, we are avoid smoking, alcohol, and low sodium diet, and low intake of high cholesterol. And then I discuss the complication of myocardial infarction. In complication of myocardial infarction, the first is heart failure and coronary artery damage, and myocardial tissue damage, and diabetes mellitus, high blood pressure, and pulmonary edema. Then I summarize my topic, myocardial infarction. First I discuss the definition, after that I discuss the causes of myocardial infarction, then I discuss the pathophysiology of myocardial infarction, then I discuss the clinical manifestations of myocardial infarction, after that I discuss the diagnostic evaluation, and then medical management of myocardial infarction, and surgical management, after that nursing management, then dietary management, and complications of myocardial infarction. That's enough for today. So thank you to all.